Can everyone see my screen? Just a thumbs up. All right, sounds good. Thank you everyone for coming today. Good morning and welcome to the 2025 Empowering Health webinar series. This series will explore the intersection of health and technology, diving into the tools, challenges, and breakthroughs that are shaping how we care for ourselves and our communities. My name is Nerese Millette-Williams, and I'm the project coordinator for the Marylanders Online program. This event today is brought to you by the University of Maryland Extension, Marylanders Online, in partnership with the College of Information and in collaboration with Family and Consumer Sciences. We have a great session planned for you all today, and we're so glad that you're here to be a part of it. Before we get started, I wanted to state that all university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Additionally, please see the following slide that includes QR codes for meeting the speakers, as well as the agenda for today and our other webinar sessions, completing our conference survey, and then registering for the other webinar series that we have through June 27th. And you can also find these QR codes on our website or your program agenda that's going to be sent to you by email. So I'm thrilled to kick off today's session. And today we're going to be joined by Lo Smith to discuss tech literacy in the digital health era. Lo Smith is an executive director of the Baltimore Digital Equity Coalition, leading efforts to unite community members and organizations around a shared vision, ensuring all Baltimoreans have access to low-cost, high-speed internet, digital skills education, and appropriate digital devices. It's an honor to have you here with us today, Lo, and everyone please welcome Lo.
Thank you
You're
so
on mute.
much. Now I'm going to take over screen sharing from you. Oh wait, you have to, there we go. Hey y'all, I'm Lo. I am going to share my screen in that awkward moment of transition, and then we're gonna get started. I believe you can all see my screen, but can somebody throw me a thumbs up if you can see excellent. Great, thank you so much. As mentioned before, keep introducing yourselves in the chat. It's really helpful for me to know who you are and where you're from. I don't just want to feel like I'm talking to folks who are new to this world, nor do I want to assume that everyone is me and Amy Schoen in this group. Folks who have been doing digital skills and sort of like health work for many, many years. If at any point in time I start talking about something and I didn't explain it, throw it in the chat, ask me for a definition, and just say define and throw out that word or that acronym. There's no reason that you should be looking for context clues from someone like me. I should be telling you everything. Speaking of, who am I? Thank you, Nerese, so much for that little bio. I am Lo Smith. I am the executive director of the Baltimore Digital Equity Coalition. I have previously worked with the National Digital Inclusion Alliance, the Enoch Pratt Free Library, the University of Baltimore, and Baltimore County Public Library in the world of library science. So I was previously a public librarian, and I am repping my summer reading shirt. Summer reading starts tomorrow, and I'm so excited to get my next shirt from it. And also, I've worked within the digital skills and digital equity side of libraries as well. I'm from Baltimore, Maryland. I'm here coming to you live from Baltimore. If you want to talk about the Orioles game that's happening this afternoon, we're playing the only team worse than us, and I think we might win. So if you need a good boost to your day, and you are coming to us live from Wisconsin, New York, King of Prussia, all those other places that I saw, may I recommend turning on the Orioles game at 4:30. It's not going to be good, but it sure will be something. Um, Anything else about me and my work? I've also done a lot of work in the intersection of health and digital equity. I have worked alongside Johns Hopkins in a variety of different roles in public health and research, as well as advising some of their digital skills program and outreach now. I spend a lot of time thinking about technology and thinking about health. So we're going to get into, as I promised, defining some things so that we don't get totally lost within the world of what are you talking about, Lo? I'm not sure what I'm supposed to be here to learn. Don't worry, I got you. Let me make sure I can move things around on my screen and not lose them. There we go. All right, so what is tech literacy? Tech literacy is an early term. It popped up actually sometime way before we got into things like digital equity and digital skills. It's been used interchangeably with digital skills and digital literacy, but the basis of all three definitions comes down to this idea that you can not only use the technology, but you know how to engage with tech in a way that is useful and supportive to your existence. You understand how to evaluate right from wrong. You know what's going on. You can feel safe. You can create things. You can communicate. It's all of the things around the experience of being fully engaged and self-sufficient with technology. Tech literacy sometimes is broken out more into the idea of thinking about the device rather than the whole digital skills ecosystem. But as much as I dug deep into all of the different definitions on tech literacy versus digital literacy and digital skills, they all were defined the same way, which also speaks to the fact that we've been using different definitions in different communities. Often you'll hear the phrase digital skills, which came up after the usage of digital literacy waned, as literacy is a bit of a binary experience. You can or you can't be tech or digitally literate, but all of us have digital skills that we can gain every day, and I am including every single person on this webinar. They're all things we could be doing to learn and grow within our digital skills. So it kind of removes that idea of being or not being literate in a topic, but instead discussing more of the spectrum of like, wow, we could all use some growth. So when it comes to tech literacy, the way I'm using it today is just within that access, evaluate, integrate, create, communicate side of things. What you're actually also wondering is what the heck is digital health? Is digital health my Fitbit? Is digital health having a My Chart portal? Is digital health the telehealth therapy session that my spouse just finished 2 rooms over? Is digital health the idea of like personalized concierge medicine where you can talk to a doctor on your phone? And the answer is yes. Everything within digital health, it is, according to the FDA, it's everything within the digital health, mobile health. So everything that happens on your phone, your computer, your doctor's computer, wearable devices. I've got a Fitbit that is about to bite the dust. So I just ordered myself a new watch. I'm very excited to test out what kind of heart rate tracking I can find with something else. It also includes the appointments that you have, the moments in which you text your therapist through a secure portal, and everything in between. So when I'm saying digital health, that's what we're really going to be thinking about in a wide and a small range. There are areas of digital health that you're wondering, does this fit? I would say the answer is yes. So without tech literacy, as we discussed, tech literacy is that ability to use, to engage, to evaluate, to participate. I really think participate is a missing term. But imagine not being able to participate in the experiences of digital health because you lacked the ability to engage with technology. First of all, it's going to look like a loss of communication and participation in your own health, not being able to use health portals. I think most of us these days use health portals when it comes to we log into our health insurance. That's how we signed up for it. We're looking at making appointments with our doctors, communicating, looking at our own test results. Many of us feel like bigger experts on our health because we're able to see what's actually there online. It's a lack of understanding that there are options for appointments. I think many of us recently have been offered an appointment where it's like, hey, you could come back in next year, or if you're interested in doing telehealth, we could see you in 2 months. And that's a really common thing that we've been seeing is that there are more options with telehealth. There are more options to receive care, discuss different things with different doctors, and even being able to connect in some cases across state lines and finding specialists that are available specifically to you. If you don't have that access, it's entirely off the table. Also, without that technology literacy, you're not going to be able to use health tools or connected devices. Many of us these days are able to symptom track, even if we don't have anything actively that we are keeping track of. We're using our Fitbits and our Apple Watches and our Pixel Watches to be able to keep track of what's my heart rate doing? we're getting abnormal heartbeat notifications, which many of us would never have even known was taking place in our bodies. We're able to take a look at how much we've been sleeping, what kind of sleep we're getting. And this is all valuable health information that used to have to be recorded through all kinds of wild tests and things that our health insurance may not have covered that are now just available to the everyday user through our smartphones. It's also about not being able to engage in really like patient-led um, experiences. So looking for second opinions, being able to research a doctor or join a resource group. For anybody with a chronic illness on here, you know how important resource groups are, whether it's a Facebook group, a Discord server, or a different place where people with the same health conditions can gather, discuss, share resources, share information, and talk about advocacy for themselves. But it's also about not being able to appeal the wrong decisions being made by your healthcare, such as being denied a very basic routine appointment and being able to just click a button that says appeal. I don't know how the healthcare appeal situation would work without a digital portal. I think there's faxing, there's letters that can be sent in, but it really slows down the process. So without that tech literacy, you're losing access to so many key pieces of the digital health experience. But not just that. There are other things about daily health maintenance that not having tech literacy can impact. If you're like me, you have no idea when your prescriptions are due to be refilled. You look in the bottle, but most likely you're getting a text from CVS. Right before I started here, CVS reminded me I'd refilled a prescription earlier this week, and they're like, you have 6 days to come get it. I don't think I probably would have remembered to go get it without that notification, without them reminding me to authorize a refill, without that request that automatically comes through my CVS app to my doctor. The CVS app for me is part of digital health because it's something that helps us to maintain and manage our health. Also, not being able to properly document the symptoms and experiences of patients can be really key. Digital literacy and tech literacy and digital health doesn't stop and start with a patient or a end user. It's taking place all over within the health world. So if you don't have tech literacy as a provider, that's going to have a seriously negative impact on your patients. Because if you can't write down what they're saying, if you don't know how to document it, if you don't have the speed to type that, and you're putting in notes that are incomplete, that's really going to change the healthcare experience of that patient, especially when someone else reads those notes and goes, I don't know what they're talking about. Or not being able to include, upload, and attach documentation and test results. I think all of us have been in an experience where someone has gone, I don't know what happened to those tests you got, let's do them again. So making sure that that doesn't take place and have a negative result. There's also the possibility that without tech literacy, there can be a misunderstanding or misdiagnosis. And of course, the icon that I put in here managed to cover the end of diagnosis, so I apologize for the clipped off word. But misunderstanding of medical history. If you're seeing incomplete medical histories or due to digital skills being unable to enter a complete medical history, this can result in anything from incorrect diagnoses or having prescriptions and medications prescribed that may be dangerous to that particular patient. Or when it comes to medical providers engaging with one another, if they're unable to fulfill the correct information that they need to communicate with each other, there are going to be moments in which critical diagnoses are missed. Because if someone is reviewing that documentation and all of the details aren't there, you won't be able to figure out what it is. A lot of us get our health information and our details from TV shows like House, but I think The Pit has been one of the more accurate worlds of documentation and also healthcare these days. And for anybody who's a healthcare worker, let me know in the chat if you also believe that The Pit is the ultimate TV show on healthcare. But one of the key things that come up there often is the communication between doctors and clear communication between patients and providers when we add in a digital aspect, if digital communication is not your jam, I mean, we've all had to text with a family member before. Ah, yes, we've got somebody saying yes to the pit. Somebody agrees. But I think we've all had the experience of texting with someone and not being able to make them or ourselves understood. Imagine that in a healthcare setting. We are going to move to a place where misunderstandings, miscommunication, and danger are so much higher. And then engaging in preventative health choices is another really key piece that without that tech literacy, without the ability to understand what one can do for themselves, back to the sort of patient advocacy, symptom tracking, writing things down, understanding when to engage in preventative measures, really, really key to the ongoing future of just preventative medicine. And as we know, a lot of what folks are looking for these days is prevention rather than treatment. And digital health is supposed to be a major aspect of that idea of prevention and tracking. Without it, we're going back to, I don't know, the 1980s, where we're just trying to deal with whatever's popped up and hope for the best. Digital health continues to expand. We are always going to see this digital divide opening wider and wider every year. It's an issue that we are chasing down ourselves. We are trying to address the disparate impact of the digital divide. Same thing with the digital divide with regard to digital health. Without critical support, we're going to see that divide continue to the point where folks are unable to keep up. One of the things that I've recently been providing a lot of instruction on is how do you log in to a basic portal? And explaining a login these days is really difficult because you've got to do like 10 different things. You have to perform a tap dance. You've got to have 12 characters and two numbers and at least one capital letter, and you've got to click on a photo. There might be a security question. Explaining how we got here has been really tough to some folks who haven't engaged in logging in before. And the two-factor authentication, Bori, exactly. Last night I watched the movie Hackers. And it's one of my favorite movies because one of the passwords they talk about all the time is people just use the word God. It's three letters. And my spouse just started laughing because they don't do anything with technology, but they're like, that wouldn't fly these days. And I was like, try explaining that to a new user because they're still in 1995 levels of password engagement. So thinking about the gap in password choices between 1995 when Angelina Jolie and Johnny Lee Miller were running around New York on their rollerblades to now, and then think about that when it comes to digital health. Back in the day, digital health was like maybe you got an email saying you had a doctor's appointment. Now everything's taking place online. One of the key things that I need to always, and I would like everyone to join me in hammering home for everyone around us, is that lack of tech literacy is not noncompliance. If a doctor or at requests someone to do something online and they do not have the digital skills to do that, that is not noncompliance. That is not them checking out on their healthcare. That is not being disinvested in their future. They are not being a non-compliant patient. It's the lack of engagement that should be met with curiosity, with support, rather than being seen as a negative. When I first started working in digital skills in libraries, I had a woman that I worked with who was a branch manager of a library branch in East Baltimore. And she said that there were so many folks who were just not willing to use the computer and were just lazy and wanted her to do it all for them. And I stood there and genuinely like tried to contain my emotions while I was like, Sandy, do you think maybe it's not that folks aren't willing, but that folks don't know how? And it had never occurred to her that the community members that she was imagining as like unwilling and disagreeable and lazy were in fact folks who were really struggling with their ability to engage. So removing the judgment from the experience of people who are not engaging with their digital health is the first step to really making sure that you're cultivating lifelong digital health users and that you're helping folks not only get engaged, but stay engaged and not feel like there's going to be punishment or consequences or penalization if they're not using the tools that you have requested them to use. Our goal is to cultivate digital health users on all teams. And this, I mean, patients, community members, caregivers, even folks who are at the reception areas. We want to make sure that everyone is available, everyone is participating, everyone in every household, but also those who wish to, and still having options for folks who are not going to be able to consistently digitally engage. So we are going to always start by assuming that everyone is trying their best. And this goes back to what Bori just put in the chat. Are folks unwilling or unable? We want to assume that everyone is maybe perhaps unable, but willing to learn and ready to learn. We want to avoid any assumptions about technology usage and understanding based on identity. And this is a particular one of thinking about not assuming the digital skills of someone based on how they appear in the chair in front of you. I think a really solid assumption is that if I told you that I play roller derby. One of my roller derby teammates, her name is Riz, and she has pink hair, and she is a mom of two, and she also is in the LGBTQIA community. All of us would assume that Riz has some really high tech skills, and that's true. She actually is a ex-hacker for the US government. But I think all of us made a positive assumption there because we were thinking about, oh, that's absolutely the kind of girl who's got like a fancy gamer chair. She knows what's up. She's got a great computer. She's keeping her kids safe online, and that's all true. But also, we don't want to bring those same assumptions in a negative way. If someone sits down and they're an older adult, if they're a community member from an immigrant community, if they're a community member who is coming from a particular neighborhood that is identified as low income, we don't want to naturally assume that folks do not have the same skills and access. My grandfather had about a seventh grade education. He grew up in Northeast Maryland. That's a town, for those of y'all not from around here. He was about 80 years old when he started teaching me to use computers. And the most that I learned about computers and about the digital world was from my grandfather between when he was 80 to when he passed away at 93. He was the person who recommended to me the kind of technologically savvy car that I wanted to buy. And so whenever folks made assumptions that Jack was not going to be able to use his computer because he had that thick Cecil County accent and he was a little bit of he had very much the like round shoulders and didn't always make eye contact and a very, very rural guy. Um, he was going to be the first person to show you the way you should be doing it. So making sure that we're not making those assumptions based on how folks appear in front of us. We always want to assess the digital skills competency when we're working with folks before we start asking people to engage in something that might be difficult. We always want to identify community resources for our digital skills. We want to know who's out there providing the one-on-one training. And if there's no one doing it, take a look around and go, do you guys think this is something maybe we could get up to? Because if there's no one else doing it, it's on us. And then preparing for all of the non-technology, non-digital skills-based technology barriers that come up to digital health, because these are the ones that are a little bit harder to navigate, and I'll share some examples of those a little bit later. Also, as I go through, I promise there are going to be some tools that I'm sharing, so I'm not just getting vague and theoretical. We're going to get into some really fantastic tools that are out there to help us cultivate lifelong digital health users in all parts of our communities. But I like to think about positive assumptions first. And this is something that also I really get into when it comes to working with a digital skills user. Assuming that the user has baseline common sense in problem solving. Even if they may not have the digital skills, many folks who have been out there living their lives have a higher level of common sense in problem solving than most of us stuck behind our desks. One of the reasons that I always use my grandfather as an example, Jack was a really, really amazing mechanic and a whiz of a mathematician. So taking those problem solving skills that he had developed over time and applying them to technology was how he became a tech whiz in his 80s. That's how this man was able to go, oh, it's just like an engine, or, oh, I understand the way that things work. I can apply that to technology. And that is something that we always want to acknowledge and honor, that many folks who are learning technology have this exact same skills they need. They're just learning how to apply them to technology. And in this case, applying those skills to digital health. So making sure that anybody who is walking in, you don't just think if you don't know your digital skills, you don't know anything. Trust me, those folks have more skills than any of us could forget in a lifetime. And also, always going back to do not assume that a lack of digital skills is by choice. Often, the ability to miss digital skills by one job, by 1 month, by one update is really key. I think many of us, when we get a new phone, I am looking forward to getting my new watch today, and I know it's going to be a learning curve. I'm going to be frustrated by the experience of not knowing exactly how it works. But we've all gone through the experience of missing an update or jumping 2 or 3 phone editions or computers or Windows versions ahead somewhere and suddenly realizing how much we've lost and how much we've missed. Also, particularly when thinking about folks who may have been incarcerated or may have lived in other countries and then returned to the United States who had a baseline level of digital skills before their departure. Even folks who were deployed in the US military. Often that time away can result in a large gap in digital skills. And thinking about if someone was incarcerated for 30 to 40 years, the last time that they were home, their TV remote was asking their little cousin to turn the dial. And now they're able to operate every TV in their home from a smartphone. So thinking about that gap in digital skills and that loss of choice when it comes to being able to learn is really key for finding a good mindset for that positive assumption and working with creating those lifelong learners. One of my biggest requests in life for all of us is that what I did when I first got on here was I was like, I want to know who you all are. Tell me what you do. Tell me where you're from, which was helpful to me because I knew that if I was going to talk about Maryland, I needed to make sure that some folks who didn't know as much, we've got people from New York City on here, that I'm going to clarify that Northeast Maryland is not a place, but actually the name of a town. And when I'm making sure that I'm talking about things like digital health, I'm seeing we've got people from affordable housing. We've got regular digital navigators. We've got case managers here. We've got folks from mental health from the Office of Statewide Broadband. I'm making sure that I'm assessing what y'all know a little bit before we get started. And particularly looking for assessing digital skills before beginning to connect somebody with digital health technology. And this might not even be something that we particularly are a part of, but advocating for that. Before you ask someone to download an app that may be able to regulate their blood sugar, let's make sure that they're comfortable using that phone. Because if we're transferring the responsibility of their blood sugar management to a smartphone, we want to make sure that they're not only able to use it, but confident in using that phone. That they would be as confident in engaging with that app as they would be directly a blood sugar monitor that they would be wearing. So thinking about it in that direction, assessing the digital skills, addressing the digital skills before handing off that piece of tech and saying, here you go. And that might look like asking someone, all right, so there's this app that we can really use to monitor your symptoms. Or on the other side of things, if you're working with a team and you're saying, all right, we're going to be rolling out this tool for all of us to use as we're visiting our patients, as we're engaging with our caseloads this week. And before implementing it and saying everybody uses it on Tuesday, instead saying, all right, how are we feeling about our skills? When do we think we'll be able to start using it? How much do we need to build up to this? Because demanding compliance gets us nowhere if we don't know how to do the thing. I just saw a fantastic note in the chat that Marylanders Online, shout out to Marylanders Online for having us all here today, had Thomas Weidemer, who worked as the lead nuclear physicist on the Apollo 12 to 17 missions, joining their digital skills class. Exactly. Can you expect a lead physicist who knows everything about probably the back end of computers when they were all just little green numbers on a black screen, joining a digital skills class so that he can be ready to engage in the current digital world? I'd be really excited to know what he learned. I'm really hoping he was learning about like Zoom and digital communication, and also any skills that he needs to really feel confident in being able to communicate what he knows. Oh my gosh, there's even a recording of it. I love this. So let's talk about assessing digital skills because it sounds really dramatic. And I know that I'm like, we need to assess our digital skills before we engage. It doesn't have to be a big deal. It doesn't have to be something formal and fancy. You don't have to like slide a survey across the table. You don't have to share a QR code where someone brings up a quiz and then they take the test and it tells them that they failed and then they feel really bad about themselves. So when it comes to addressing digital skills, I'm a big fan of the verbal format. I'm going to share an example of a verbal format that I've developed previously and used as well. So the verbal format is really great because you can have a conversation and it can go, so how comfortable do you feel using your smartphone? Do you want to like rate that on a scale of 1 to 10 or like really uncomfortable to pretty comfortable? And then the conversation can continue. Well, if you're comfortable using the apps that you do have, how do you feel about you downloading a new app? Okay, so you usually feel pretty good. You can figure them out. So in next, if we were going to give you this monitor and it does have Bluetooth, how do you feel about connecting a Bluetooth device? Have you ever connected a Bluetooth device before? Do you think this is something we could go over together? You need a little more practice. So that's as simple as what I mean when I say assessing digital skills. We are asking folks directly, verbally, in a way that gets us more information about their digital skills. Verbal assessments and questionnaires are just as useful as performance-based things. If you're looking for something and you're doing science with it, you may want to go for something that's going to have a little bit more of a formal method. So if for some reason you're trying to assess digital skills for digital health and you're like, this is going to be something we'll publish, definitely creating a formalized assessment that could still be verbal, making sure that it fits in with all of the other literature on assessment, and then using that. But many of us out here are just trying to make sure that we're getting our community members from point A to point B. We're getting our CNAs connected to the right computer system. We're getting our patients or our caseload connected to the right thing. We're making sure that clients are able to do the things they need to. We're not trying to do science with it. So we don't need to be using the exact same formal verbal assessment every time. We don't need to be following a particular prescribed set of questions. But if you are more into the formal assessments, you can do those. You can have them use something like North Star Digital Literacy Assessment, which is one of the premier ones that's out there that folks have been using for years, but it does require a little bit more hands-on support. If you saw some of the quotes that I got a little loud and verbal about at a conference a couple of weeks ago, one of the quotes that was really floating around that I apparently said was, um, digital skills can't be taught and assessed online like entry-level ones because doing them online is an entry-level digital skill. So thinking about that when it comes to a virtual assessment, ensuring that there's somebody there to guide a community member through that assessment to make sure that they're able to actually do the thing that you're asking. So when it comes to assessing digital skills, I am going to try to remember to bring this up on a different screen so that I can share the link. Did I click on the right thing? I am doing some of my best out here. But when we're really thinking about it, the NDIA Digital Navigator Assessment is a great skills assessment that uses, and now I drag and drop and hope for the best. Gotta switch my screen share, perhaps. Okay. I tried. I'm going to grab the link and just drop it in for all of y'all so that you can take a look at it. But it's a skills template with this idea of being able to try it out, mess around with it, see what works for you. And then also the North Star Digital Skills Assessment. And this was the one that I mentioned was the virtual one that moves through a lot of questions. And I do recommend take each of these on your own. See how they feel, because one of the things you're going to see is that like sometimes you take one and you're like, I thought I was really doing great. I thought that I was particularly tech savvy. And after doing this, I don't feel so good about my skills. And I do this every day. So identifying a little bit of sort of the emotion and the value judgment that might show up within these, particularly if you weren't as confident in your digital skills. So more of like, what are we doing about it? So we're going to assess digital skills before we're connecting folks with digital health resources. And then also, what do we do when we determine that that community member, that client, that doctor, that caseworker, maybe that patient doesn't have what they need? We are already going to have identified the community resources and supports. We're already going to know where to send them. Step one, assess. Step two, referral. Basically, it's the same idea of looking at somebody and going, ooh, those are symptoms of a thing that I don't deal with. Go see my friend. Same thing. The lack of digital skills are symptoms of something that many healthcare providers don't treat, a need for digital literacy training. So being able to refer folks out to a community organization, to someone who's already well-versed in this work is key. For a lot of us, it's going to look like developing relationships. Developing a relationship with a program rather than just doing sort of a like, here's a number, call it, or like, on Tuesdays, you can walk over here and support them. But developing relationships with the local and virtual programs is really, really key because it means that you can ask specific questions. Like knowing that if I'm going to be sending someone over to the Ashland Community Center on Thursdays, there's going to be a group of digital navigators, and this is actually a real program. There's going to be a group of digital navigators from the Johns Hopkins telemedicine program doing a sandbox style hands-on program where folks can mess around with my chart. And I know that they're going to be there at the Ashland Community Center every single Thursday for the next 3 months, which is fantastic because if I have someone in the Ashland area who needs that support, I know exactly where to send them. But if I know that someone is just looking to figure out how to check their email and they're really struggling with that because that's how they are receiving information from their digital health apps or providers or tools, I can just pass them off to the digital navigators at the Pratt Library, making sure that they know that they can drop into any of the library branches when there's a digital navigator on staff, and that person can help them out. A really key thing to know is whether or not programs are providing one-on-one support. Most folks are going to need one-on-one support for a lot of their digital skills training. There's a lot you can learn from a class, but a class is going to not give them specifically a lot of the digital health skills that they're looking for. Logging in, understanding two-factor authentication, checking an email, logging into an email consistently, being able to download apps, checking app settings. A lot of these things that are not even particularly proprietary to digital health world are going to be just more specific that aren't going to be covered the exact same way in a formal class. We don't want to be sending people to sit through a 6-week class on the basics of email when they just need to learn to log in. Unless they come in saying, I want to learn everything about email, thank you. In which case, heck yes, we send them off to the class, they get that attention. So knowing whether or not you're sending people to one-on-one programs of support, to classes, and knowing if it's going to be on the phone. Often learning over the phone, having somebody talk to you where they can't see what's in front of you can be really tough. Knowing if it's virtual, because being able to get somebody connected virtually, in addition to then working with them on that device, tough. But if we can make sure that we know exactly what's up, we'll be able to move ahead and consistently help our communities, and know that they're getting the most out of that engagement. So some examples for identifying folks. I've included 3 examples here from the Maryland area, and when these slides go out, I'll share the links with y'all. But you can do a quick Google on any of them if you're interested. Some examples include Marylanders Online, once again, right here. Their online tech support helpline. So you can call there and say, hey, I keep getting this same message. How do I log into my email? The computer training classes at the Pratt, having that ability to send someone to do that all the way through training. Senior Planet Center in Montgomery County offers the Older Adults Technology Center, or OATS. It's coordinated by AARP, and they have specific classes in person for seniors as well as one-on-one support. So taking a look at all of those key pieces and figuring that out. Also, shout out to the Carroll Technology and Innovation Council for supporting their communities as well. If you have a program that you want to shout out right now, throw it in the chat. I want to know about it. Another key resource that can be both used by everyone, whether it's by the digital navigators who are serving digital health users, whether it's by providers who are like, I don't even understand how to explain this to somebody because it all comes so naturally to me. Community advocates, anyone who's really going to be doing any navigation, even if you're just a friend, a family member, a caregiver, or a person yourself who will be doing telehealth. Navigating the telehealth neighborhood is a sort of online taught class. I will drop the link for this one because I think it's so critical, that is provided by the Northwest Telehealth Center. So they are out of a region of Washington and Idaho that is particularly rural, that is dealing with a world where they had telehealth centers for many years because there were not providers in their area. Almost everyone was receiving healthcare through telehealth because that was the only option. But folks were driving 1 to 2 hours to access a telehealth center to have that appointment. So they're experts in the world of telehealth. They're experts in the way of patient portal training for digital navigators. This is a really great course. I introduced it to some of the folks I've been training, and it actually left them with more questions than answers because it's so in depth, which I love. But Now that we've gone over sort of the like, what do we do? How do we assess the digital skills? How do we start solving for, referring out, supporting everyone in our communities? We also want to think about some of the non-digital skills barriers to digital health engagement. I know that was a lot of words to basically say. It's not always the ability to use the device or to have the digital skills that will get in the way of someone's engagement with digital health. And it's just as important not to engage with judgment or to see this as non-compliance, but instead to identify what is the barrier, address it, and ensure that that community member is able to engage the same way everyone else is. And again, when I say community member, I mean everybody, from the workers on the inside, to the doctors, to the caseworkers, to the social workers, to the nurses, to the CNAs, to the patients, to the clients, to the caregivers, to the babysitters. Everyone who would be engaging with digital health. A big one is written literacy skills. Do y'all have any idea how many words I have been putting up on the screen this whole time? I say a lot of words, but I'm writing out a lot of them. If you're not confident in your written literacy skill, you are probably not going to be engaging in a screen with a lot of text on it. And what is every app and everything we do these days? It's a screen with a lot of text on it. So if your written literacy skills aren't a comfortable level, you're not going to be engaging with digital skills. And digital written literacy skills are a muscle. You can lose them. You could be a highly qualified doctor who just has not been using their written literacy skills. They haven't been reading and writing consistently. You can lose the ability to read fast and to feel comfortable looking at a wall of text. Another big one is English language fluency, the ability to read and understand, but also within written literacy skills, that can be non-English. Plenty of folks with it throughout the world can can speak confidently in their native language, but may not have the literacy skills due to a variety of barriers, including plenty of languages do not offer a written language. I've worked with a lot of really interesting folks who are members of Native nations across America, and plenty of Native nations do not have written languages the same way we would expect. So the idea of translating an app into a written language for that community may not exist. So you may not be able to have a written literacy skill for that particular native language. English language fluency goes right with that. If your language is not English and everything is provided in English, it's not going to be as easy to engage. Visual and cognitive barriers are a big piece of digital skills for everyone, particularly for older adults. But this is something that we often see with anybody. And let's admit it, anyone over the age of 30, raise your hand. Our eyes are just not what they used to be. Many of my friends are getting the cutest reading glasses ever. So, if you're not able to read smaller text, and if you're not regularly engaging with small text, you may not even know that you require reading glasses. You may not know that you do not have the vision to read. Another key piece is for folks with chronic illnesses, and particularly things like long COVID, cognitive barriers of things like brain fog and mental fatigue that aren't as identifiable because you're in them can be harder to identify as this is why I'm not able to learn or engage with this. Another big piece is fine motor skills or inability to use a touch screen. Um, I I love talking about bodies and health when it comes to touchscreen usage because one of the things that we know is our touchscreens are operated by the electricity in our bodies. It's the electricity carried by our fascia, and fascial diseases are just as real as many others. So, plenty of folks out there may be unable to use a touchscreen. We know that older adults carry less electricity in their fascia. It's just how their bodies are built. So, if you ever have a community member who is older and is saying, my fingers don't work on this touchscreen, they're not lying to you. They may not have that ability, or they may not have the fine motor skills from arthritis, from injury, or from a lack of regular usage of fine motor skills. We all know how hard it was to first use a mouse. Imagine when you first use a touch screen, being able to aim at smaller places is just a muscle that needs to be built. Some other barriers that you may encounter are going to be folks who have a lack of privacy or quiet to engage with a telehealth option. They may be very active in one side of their digital health, but you're saying, we need to talk to you. We need to have a one-on-one conversation about your test results. And they're saying, I can't do it. I can't do it. I won't do it. And it may be because of a lack of privacy or quiet. There may be multiple generations in a home. There's no place that someone could go with connectivity to have a private conversation about medical things. And that could be on either side, having folks working from home who do not have a quiet place to provide those conversations. Unhoused or inconsistently housed community members would lack consistent access to internet, to the electricity to charge their device, as well as to a private or quiet place to have those conversations. The lack of home internet access is not just a barrier to folks who are low income or of marginalized communities. I think many of us in 2020 discovered that some of our colleagues, I was working at a library, I discovered that a high number of my colleagues did not have home internet access. It was both a choice that they had made financially, but also because they had access at work, they felt that it was redundant. Plenty of our community members and our colleagues may choose not to have internet access at home if they're not working from home, and a sudden shift to work from home may change that. They may not have the internet access to engage in the digital health the same way, to chart after work hours, all of those other things. And the lack of an appropriate personal device. This one comes up regularly with the idea that iPhones can do a lot of things that Androids haven't yet received the applications for. I could go on and on about this, but we just know it's a fact. I have a very fancy Android. I bought it a while ago. But if I had recently purchased my Android phone and spent money on it, and then had a doctor say, I need you to be using this app, it only works on an iPhone, and need you to go get an iPhone, I don't know if I can go get an iPhone. I can't drop everything and buy a new phone. Phones are investments, they're expensive. There are a lot of considerations into why I choose a phone and how it works. So if there is a lack of the appropriate device, particularly if apps are proprietary to specific devices, you're going to see folks running into the barrier of not being able to have the right device for that particular need. And saying, hey, go get an iPhone is not usually an acceptable solution to this type of thing. So, addressing these issues, we're going to be wanting to make sure that we are identifying the other programs in our communities that are able to support these things. Particularly, I know I saw some social workers in the chat. Shout out to y'all. You are the real MVPs when it comes to wraparound services, to figuring out where we can get those devices, to being able to get connected in with the people who can provide the other services like sending folks to an optometrist so that they can get the reading glasses, so that they can see their phone, so that they can use the app that their doctor asked them to use to track their heart health. We also want to make sure that we're building those partnerships with those other organizations, that we know who to go to, that we know who it is in our community who's out there doing the low cost home internet work. If you have folks around, if you have the partnerships to build, and knowing who can help make all of this easier. Many programs, particularly, are designated for certain income levels. But one of the things we've seen with a lot of older adults getting involved is that they may not fall into a particular low or fixed income level. However, they are lacking the ability to engage with digital skills support, with connectivity, with making their own decisions about devices. Many programs are geared towards low income communities, marginalized communities, veterans, communities of color, formerly incarcerated folks. But there are plenty of people who just happen to be older adults who need the same supports. And just because they have a different financial status doesn't mean they're able to access anything, because while they could pay, who do they go to? Knowing where folks can go for support is really, really important, especially when it comes to all incomes. And knowing where that support lives, looking for your digital equity councils, looking for your digital equity coalitions. As we mentioned, the Carroll Technology and Innovation Council out of Carroll County. I'm here from the Baltimore Digital Equity Coalition, starting by looking for those organizations. I know for folks who are in King of Prussia, you've got a digital equity coalition in your area. Up in New York, you've got folks out in New York. There are people out there. Finding the right social workers who are connected as well. Often those social workers are within local libraries. Working with community colleges who may have classes or digital navigators can be key to building that connection. Even requesting, hey, can you guys teach a class on this digital health thing that we are all using and we need your support with? That's how the Johns Hopkins telemedicine groups started doing these classes that we're now providing to the community. Was someone said, hey, someone needs to do this. And Johns Hopkins said, well, we're not only we're not only a hospital, we're an education institution. I think we could probably figure this out. Is that the same slide? Yep. All right. Let me see if I can get my slide to advance in the way that I'm asking it to. All right, there we go. So thinking about the whole ecosystem is really my last big point before I take some questions from y'all. We want to think about a digital health ecosystem, and we need everyone on board. This means that if you've got naysayers in your atmosphere, it is one of your jobs to tell them that they are allowed to have their own opinions. You are allowed as much as you'd like to have your own opinion, just please do not make it a negative opinion to your community. You're allowed to say no thank you in your personal life to digital health tools, but if you're being asked to use them at work, we need you to come in with the same amount of cheerleading and joy as you would if someone just introduced penicillin. We need to make sure that our healthcare systems are invested in internal staff training so that folks can then provide that support for the end user as well. The number one places that I have run into digital skills support needs is when an organization, a healthcare institution, and this has been in my work for, I don't know, over the last decade and a half, all the way across the country, is someone says, we need help providing digital skills support to our community. And it always starts at home. And often the reason that the community needs the digital skills support is because the staff members are not getting it at work. They're not getting what they need, so they're unable to support others. This is a put on your, like, secure your mask before you put on someone else's. Put on the oxygen mask, make sure that everyone is getting the support that they need in their professions, in their jobs, in their volunteer roles, and make sure that it's going out and elsewhere. Um, Making sure that healthcare systems are investing and making sure that everybody, caregivers, medical assistants, receptionists, are just important as doctors when it comes to all of this. Make sure that everyone is invested and on board with assessing skills, creating those connections, building those partnerships, and making sure that there's opportunity for everyone to be involved. That was so much stuff. I'm here to take your questions. I'm here to hear from all of y'all. What do you need to know more of? What do you want me to provide resources on, et cetera, et cetera? And I'll also share my email and a little link to the Baltimore Digital Equity Coalition after this. So if your question is, what's your email? Hang tight. I will get to you. You can unmute, you can raise your hand. I will probably end up managing your questioning just as much as my team from Marylanders Online would.
Hello.
Hey, Kamisha.
Hello. I just wanted to make a comment and say
Mhm.
thank you for this information because you actually simplified some of the challenges that are faced with when we don't understand technology and we're trying to have expectations for those that we work with. I really appreciate how you detailed and you kind of simplified, especially when you just use like the whole penicillin description. It's that simple, right? Like, why do we need it? How can we use it better? And what resources do we have to support the lack of access or the lack of understanding this form of digital skills training? It's so important. So I just wanted to kind of give you a shout out and say thank you because I would not have been able to explain it the way that you were able to explain it. And this is why we need organizations like yours to come in and educate us on how we can take this information back to our staff and not make it so difficult and so heavy. Like, focus on the problem and here are solutions to what we're facing.
And that's key. Like, if we live this every day, it's very hard for us to explain it to others. And my favorite thing in life is explaining really, really high level concepts as low as I can. And I love an analogy. Give me a metaphor. I got you with the simile. I've got some
Okay.
questions in the chat that I'm going to answer. Dante asked me, should coalitions advocate for peer-to-peer digital navigation to manage digital literacy within generations? Yes. I'm going to tell you peer-to-peer, whoever those peers are, is one of the best ways to do digital skills support. If you can have an older adult talking to an older adult, and one of them is going to be able to guide the other, yes. If you can get a Spanish speaker working with a Spanish speaker, absolutely. Whatever that peer group should be and can be means that you can jump ahead when it comes to cultural competency and communication and reach a point of understanding, compassion, and learning so much faster than you would if you were trying to do something with a different hierarchy or something like that. Also, Melanie asked, do you have any specific trainings or advice for people learning to use um, healthcare platforms, for example, MyChart? Yes, Melanie, I shared it in the chat a little bit earlier. that telehealth training, navigating the telehealth neighborhood training, I'm a really big fan of that one. That is one of the few trainings that is available these days. Also in, I think, digital skills. So I'm going to drop digital skillslibrary.org is another great place that has some courses on the higher level of like what is a patient portal and how to engage. I think one of the key things when it comes to using these instructional models is making sure that there are specific people who can assist with that instruction, not just handing off a video and saying like, hey, go watch this, it'll help you. Hi, Amy. Amy always setting me up with a good hard question. How important is the geospatial equity component for healthcare workers? Oh man, that's a whole other conversation that we could go on with forever. And I think there is going to be a talk about that coming up. So this might be a good setup for a future presentation. And or it's already taken place. I know I saw it on the schedule, but someone dropped the link to that conversation that's going to be coming up because I think it's really important. And also making sure that all your healthcare workers are able to be engaged in this work, whether they are going to be physically present, whether they're going to be virtual, whether they're going to be in all over your state. Amy, I saw you come on. Did you have something to plug?
No, I just for people for whom that might have been too obtuse. The issue is if a healthcare worker is telling somebody to, get a device or get internet, that it's important to understand what the local context is, and maybe there's no affordable internet in a neighborhood because it's segregated by race and poverty and was digitally redlined. And I think that's just something that gets glossed over a lot. And, just as healthcare workers need to understand the food desert, if they're trying to tell someone to eat healthy food, they have to understand the digital desert as well.
Yeah, thank you. Absolutely. Knowing what is going on in your health ecosystem, in your digital ecosystem, is key for being able to engage in a future for all of us. And I think if you can get out there and learn, talk to the people around you, and listen is another piece. Listen to what folks are saying, whether they're your colleagues, your patients, your clients, your neighbors, your grandmothers. Folks will tell you exactly what's happening, and all we have to do is listen. I've got the question, will your slides be available? I believe so. I'll be providing a PDF of my slides to the Marylanders Online folks. They should be sharing them out with all of y'all. And I will also be giving them the thumbs up to put this on the web. So if you've missed this, it's going to go up on the YouTube channel. Last question I will be answering is the question, and if you want to learn more about digital redlining, send me an email. I can send you some great resources. I think the National Digital Inclusion Alliance has a lot about digital redlining. It's also something I'm really passionate about discussing because Baltimore is the home of redlining, and we do it digitally really well, and I will tell you why that's bad. Last question I'm covering is, do you think there will be a component added to insurances that cover digital health access? Do you think it will be incorporated on its own? So right now we do know that some of the Medicaid plans incorporate digital health access and digital skills. I don't have a ton of detail on that, but we are aware that that exists. It's something that we may or may not see, and especially with all of the changes that are going on in the future, I think that we will be hearing a lot about whether or not our healthcare plans can, will, or should include the digital skills component, or even whether or not they're allowed to include digital health. So this is something to look at as bills are currently being passed that are impacting the future of Medicaid, Medicare, and then the world of what happens at the marketplace level. It's 12:01. I'm going to stop my sharing. I'm going to hand it back over to the folks at Marylanders Online. Go enjoy your lunch, everybody. Have a wonderful Friday, and please cheer on my Orioles because the vibes are, we're doing our best.
Thank you so much for that excellent presentation, Laura. We really appreciate you coming out today and doing this presentation for us. I know we're a little bit over time, so I'm not going to take too much time. Just want to go over a few quick updates before we officially close today. Continue learning about the future of health and technology with our next session, which will be on June 6th, next Friday from 11 a.m. to 12 p.m., which is going to be about tackling social disparities in access and technology. And you can use the QR code on the agenda or on our website to go ahead and register for that. Also, you can get in touch with Marylanders Online through our website, our email, or our toll-free tech helpline, which you can also find on our website or in the email we'll send out in our follow-up. And then stay connected with Marylanders Online through our, you can scan our link tree here. We have our Facebook, Instagram, and LinkedIn, as well as a newsletter. Sign up with more events and conference information. And then, of course, please look out for our follow-up email and complete our survey, which you can find on this slide by scanning the QR code. And we'll also send it out in the follow-up email. And if permission was given, which it was by Lo, we will go ahead and upload this to our YouTube and we'll send the slides by email. So we hope you leave today feeling more informed and inspired. Take care, and we look forward to seeing you all at the next session. Thank you, everyone.
Thanks so much.
Thank you. An excellent presentation.